Grow your practice, grow your wealth, grow your impact. Find out how to spend less time in the dental chair and more time on the things you love.
Welcome back to the Dental Wealth Podcast. With me in the studio, as always, is the president, the founder of Tower Leadership, Eric J. Morin. As you can tell, we have a new guest on, and we're super excited about it. I always like to give you a heads up, Dr. Lamar. Give him kind of a well intro. I practice a lot of things to see what sticks, what I like for the day. So with us in the studio, for the people that are viewing or listening, we have Dr. Frank Lamar. He is the founder and owner of Hybridge Dental and Elmwood Dental out of Rochester, New York. So thank you for joining us today.
Yeah, thanks for having me. I'm excited.
Talking about this for weeks. We were like, yes, we get Dr. Lamar on this week. It's going to be a great one. I know we go back and forth on guests, so we're honored to have you, and we're excited about the podcast.
Yeah, I appreciate the invitation for sure.
This is a special one for me. I've wanted to have this conversation for a long time. Those of you listening, research Hybridge, because where all this came from, now I feel like I've known you for a few years, Frank, but we had a common client and they were moving and doing things through Tower. And then I started seeing their production just go through the roof. I was like, what is happening over in this practice? And it just numbers that I'd never seen, and then his excitement. So he introduced me to you, and I've gotten lucky enough to spend time with you to learn more about the type of work you do in Hybridge. But for those that are just now listening, Frank is. I respect the world out of you, Frank, and what you do and for the profession, for your own practice and for your leadership. Frank's got a practice it's your father's practice out of Rochester, New York, that you guys have had for a long time. And I know there's different functions inside that practice. So you're a clinician, but you also created Hybridge, which is a full arch dental implant system. And you do tremendous work all over the country. So we're really, really glad to have you here. And those of you listening, this is a podcast you're definitely going to want to go watch on YouTube, listen to again, because Frank's the real deal. And I'm so just blessed and honored to have you here, Frank.
Wow, that's a great build-up. The pressure is on right now, so I think I'm ready for you.
Well, we like to dive in, throw a lot at you at first.
Yeah, right.
So I'd really just jump right in, because when I think about what I didn't know about Hybridge, and one of the things I told you is I want to get Hybridge more, with more and more Tower clients, and you and I spoke about this recently, Frank, which was, when we start looking at clinical excellence and how important clinical excellence is, especially with a changing dental economy and new entrants in the marketplace, and how important is it, today? And so we start talking about the importance of clinical excellence, and Hybridge to me is the epitome of that. So I'm going to go backwards first and just ask, what is Hybridge for those wanting to know? And then how did you get started, or what made Hybridge come about?
So let me flip that for you, and let me just give you historically where it kind of came from. And like a lot of things, this was developed out of what I thought was a necessity within my practice. So the Elmwood Dental Group, as you said, we're a second generation practice, and my brother Jim Lamar and myself are partners and have been for over 30 years. So dental implants in our office has been going strong since the late 1980s, believe it or not. And Jim and I decided in early 2000s that we really had an opportunity in the marketplace to do something that was very different, and that was to amplify the messaging of what we were doing in full arch. And in early 2000s, full arch was just, nobody knew what full arch was. And but what we realized is that we didn't have the capabilities necessary to do what we wanted to do. And so we built step by step, we built individual capabilities. And so, for example, we knew we needed to do external marketing. We built a marketing department within our office. We knew we needed a laboratory part of what we did. So we built out a dental laboratory. And, I have to say that, we're all blessed, with different things that are maybe coincidental sometimes, but I was blessed with the coincidence of having a wife who was a marketing genius. So I had that advantage. And so my wife, Karen, identified the marketplace and said, this is what we're going to do. We're going to invest in 30-minute infomercials. We're going to create a brand. We're going to create a messaging that resonates with the people in our Rochester community who need really complex dental issues solved for. And that's in fact what we did. And we created this monster in Rochester back in 2004, 2005. And friends of mine noticed what we were doing in Full Arch. And I wasn't even talking about it, but a very good friend of mine said, hey, I want to do what you're doing. And so Karen said, come to Rochester. I'll create a marketing package for you. Frank will show you how we do this Full Arch protocol. And we'll share our laboratory with you. And that's sort of how it got started. Doctor number one, who's a very dear friend of mine, Ron Sambursky in Binghamton, New York, did what we did, and bam, same thing happened to him that happened in Rochester. He built a practice around Full Arch. And so, we're not the sharpest tools in the shed. So it took us a little while to figure out maybe we had something here. And so just building out capabilities, it turned into an educational program. It turned into a laboratory offering and a marketing offering. And that little ecosystem of multiple things is really what Hybridge started as. And so, you asked the question, Eric, who's it for? It really, what it's evolved into gaining access into the dental implant marketplace for doctors who want to do Full Arch and learn how to do it well. Going back to the clinical excellence part of what we do, there isn't anything more complex than removing a fully dentate, the teeth of a fully dentate patient and making sure you can put them all back together again and have them be happy at the end. A lot of people think that that's just that's basic dentistry. That's not basic dentistry. That's a really significant responsibility. And if you don't have a process, you're going to have a lot of sleepless nights.
I love that you said process, because I think, well, in Tower Leadership, we're certainly, we don't do clinical training. We're not a clinical training company. I think one of the things we hear feedback oftentimes is the confidence issue. And one of the things, I was spending time with you recently, and you talked about the lab portion, and you had said, well, one of the problems was the lab is that there's confidence in the lab, and we didn't have confidence. And maybe you didn't say this just like this, but what I inferred was we didn't have confidence in the lab work that was maybe out there, or to the level that we were going to be doing so many of these cases. If the labs didn't get it right, then we were going to have, obviously we wouldn't be able to do it in a process that gave confidence to doctors. Could you elaborate on that a little bit?
Yeah, thank you. Yeah. So, back when we started to do these Full Arch restorations, which, as most people that are listening, now everybody knows what Full Arch is. It's a screw retained implant supported restoration. It's fixed in nature. And there's a lot of different things out there in the marketplace. But what we found, because we were so early in the marketplace, and we picked a local dental laboratory who we thought was the perfect partner to do this in. And we had the process and they had the laboratory, and we were going on. Early on, it seemed perfectly fine, except that when you're doing a lot of something, doesn't matter what you're doing. It could be a ceramic crown of some brand. It could be whatever, but you're creating these potential liabilities in your practice. And if you're doing a lot of it, there's a lot of liability. So imagine we're doing dozens and dozens and dozens of these cases, and we're building, and all of a sudden we realize that they're falling apart. They're literally just crumbling. The materials were not ready for what we were doing. And the laboratory that was making these restorations for us knew what they knew, but they really weren't in a position to do R&D on materials. And so at the end of the day, we had to make a decision, either stop doing them completely, or bring it in-house and try to figure it out ourselves. And having control over the how it's made. Actually, there's a show how it's made. You'd be surprised how it's made. But when we brought it in, it took us another couple of years to do any better than the previous laboratory. I mean, it was a trial and error of, let's try this material, let's try that material, let's use this adhesive, and the materials, as they've evolved, as material science has evolved, over the last 15 plus years, almost 20 years, we're dealing with this constant evolution of durability, wearability. We came up with what we now call our Hybridge Generation 4, and that is the prosthetic product that we've created over 20 years of R&D that we feel is the best balance of all of the materials out there. It's a very unique way that we make it. The tagline, Eric, for Hybridge, actually, do you know what it is?
I don't. Now I'm feeling. I should know that.
Let me tell you. Let me tell you. So the tagline for Hybridge is a simple way to a lasting smile. And so if you separate that, and you say the simple way is the process, the Hybridge protocol, as we call it, and simple way to a lasting smile is, what are you going to put in the mouth that 5 years from now, 10 years from now, is still going to be a viable prosthetic solution? And what you put in the mouth matters. And unless you're going to move from town to town or city to city, or get out of Dodge after a few years, you better make sure that what you're putting in the mouth isn't going to ruin your reputation down the road. Because let me tell you, I've been through it. If it starts to deteriorate, or you have complications that you don't know are going to happen, your practice is at risk. And so that's something, unfortunately, I had to learn the hard way. And with Hybridge, we share these pearls of material science and technology so that our doctors don't have to deal with that.
I love that. I think that I never looked at it that way, but I think that's a really good point, is 2-3 years. I think those are the things that keep doctors up at night, waking up saying, what if this falls apart? What if we have issues? What if I can't control the lab? And then the first key part, which is, I think, is really important, which is the marketing aspect, I think is also very important. What we see at Tower oftentimes is we'll see clinicians go to an implant course. Here, they'll go buy a cone beam, they'll go take an implant course. Oftentimes it collects more dust than it does anything else. But I rarely see people, I see them start putting and that's not true for everybody, but oftentimes there's an inspiration to go to an implant course, start learning how to do it. I would assume that there would be an aspiration for full arch, but maybe that's not true. And then they even if they get the clinical training down where they feel good, they've got the cone beam, they feel like they have the tools, oftentimes they don't have the patient base for it. They don't know how to truly market it. And I see, so I think confidence, it seems to me, is the biggest gap. But like I said, I'm not a clinician, but I think the other side is the even if I can get confident in this procedure, can I get enough patients to do it? And so you talked about that marketing side of it. You said that was pretty important at the beginning. Is that still an important part of the Hybridge process, is the marketing piece, or if someone is having a hard time with that part, what are your thoughts? Ultimately, give me some thoughts on that.
So, I think any practice has a number of Hybridge cases within its four walls already. And I think a doctor who already has implant proficiency, quadrant implant dentistry, is comfortable surgically. We always say you really have to, if you're going to do both the surgical and the restorative part of full arch or of Hybridge, you really need to be properly educated on both sides of it. And that's really where the super GP kind of comes in. They go out there and they take these continuum courses, and they really have an interest, and they say, I want to do implants. And they go out and they take the courses you're talking about, and they get good and they get confident. And then they go, man, I really want to do more. And I see these cases coming through, but I really don't feel comfortable. But really, proficiency first, quantity second, really developing the practice's flow and the confidence, not only the doctor confidence, frankly, but the office as a whole, the team's confidence that this is something that we do. We've done multiple cases well. They can think of who they've done. They've seen the transition. They've seen the effect, the impact that they've had on a handful of patients. And then they go, you know what? This is in fact something we really want to do more of. That's where marketing comes in. Marketing doesn't come first, proficiency second. It's kind of, that's backwards. First get good at it, feel confident, and then if you want to do more, now you open up the doors, you go outside of the four walls of your practice, and you start creating messaging that this is something that you're good at, and you become a part of a voice out there, and the no-brainer voice out there, right, is online.
Right.
Using a brand like Hybridge and the content and we think educating the patient is the best way to market what you do. If you can educate people who don't know what's available, it's just the no-brainer. It's like now they understand that this is something that exists and you do it, and therefore they contact you. And so the marketing thing is a great tool, but it's a very powerful tool that should not be used incorrectly. Because
I love that you said you have to get the process down in the organization first. I think, whenever we have clients that ultimately are like, yeah, I need to get, new patients in the door, like, well, let's make sure we have a solid process before we just start spending a bunch of money in marketing and you can't even answer the phones. So I think, that does bring the confidence to the rest of the organization. It's not just the front desk that needs to be confident. It's everyone involved in the process, because once you get that locked in, you're in good shape. And this is like music to Eric and I's ear when it comes to, this is like a case study almost of how to run a business and create another business in the process. I think sometimes people might be listening to this and they don't realize you still have a dental practice. Like you're still operating a dental practice and Hybridge. So I am, I've always been impressed with what you guys do. And this just kind of speaks to the fluidity of what you created and the process you have in place. And now you're nationwide with Hybridge and you still have this successful practice. So, people that are listening in and they're saying, all right, how's he getting all this done? Lean into these conversations, ask the questions, venture out, look at your competitive advantage. I think Eric always says there's something you can be better at than anyone else in the entire nation. So what is it? And you took that element and turned it into a thriving business outside of your dental practice. So unique case study. We might have to look into that in the future. I'll have Kyle Reese make a note. We might have to bring you on for a case study for that. But I love what you guys are doing.
Thank you. Appreciate that.
One thing you said recently, see, I'm listening, Frank, even when you think I'm not listening. One thing you,
I can always tell you're listening when your eyes go up to the left.
Left. Yeah.
I don't know what you're looking at up there, but I know there's something going on.
You pointed that out. And now since you pointed that out, I think about it every time. Now I have to tell people if I start looking off to the left, it's because I'm actually listening to what you're saying. Well, one of the things you said.
At first I thought there was a vision going on. I'm not sure.
There's a spider on the ceiling or something. It's like, I guess that's my tell. That's maybe why I never won in poker. But now I know what my tell is, I guess.
Yeah. I wouldn't suggest poker as your, yeah.
Man, I wonder why you took all my money, Kyle. I don't know. But what you had said which was really good, and I loved it, which was, you were being asked about the impact of Hybridge and the work you do. And one of the things you said was, some of the biggest impact that I enjoy through the work of Hybridge is the younger people, is that, is the youth, the people that, now have a different lease on life, that they're, whether it's getting a mate or a job or whatever it is, or the combination of the two. I thought that was really, really impactful, because this work is really impactful. And we talk about that a lot at Tower, and the impact of the type of work. And if you could just speak to that for a moment, because when I thought about that, I guess most people think about this in older patients, or oftentimes older patients, but I really enjoyed it. And I know dentistry does a lot, in far as smiles, but this is a really, truly just impactful, system. And anyhow, I just wanted you to speak to that for a minute, because I just thought it just took me back when you said that.
Yeah. As dentists, I think when we go to dental school, we do think we're going to have some impact, but I think, when you're doing micro dentistry, a tooth or even a couple of teeth, and you're dealing with margins, you're dealing with root canals, you're dealing with the micro, area of the mouth. It has its certain impact, but what I didn't realize, 30 years ago, when I decided that prosthodontics and or implants was going to be my life's work, I had no idea that I was going to have this ability to impact the life or the lives of people in a very significant way. And we call it the Hybridge ripple effect, which is sort of like, let's say we do Hybridge on a 30, 40, 50-year-old, but in their dental health is having such a bad impact on their life, to what you said. They're not dating, or they have a bad relationship, or they're insecure, their job is being affected, they're being judged. There's a lot of ways that somebody's life could be negatively impacted. Now you cure that, you solve those problems, you give them a completely different exterior personality, where they're bright, they're smiling, their energy is up, they're communicating in ways that they haven't communicated in years. And now all of a sudden, what happens to their life, their kids' lives, their spouse's life? Like that ripple effect is something that is profound in full arch treatment, and actually in dentistry as a whole. I don't think we sometimes realize it, but that's the most fun part, and that's the addictive part of it. Handing that mirror to somebody and saying, why don't you take a look at what we did? And you just see this emotion boil to the surface, and it's just, we don't realize how deep they've been injured by their teeth. It's really something to watch.
I love that. I love that. That's why when you said that, I was like, that's so true. And literally changing the trajectory of someone's life. That's a ripple. That's you'll never see the true ripple effect. And sometimes I talk about that as the ripple effect of the work of when we touch practices, when we do these types of things, it's like, you never truly know all the people you've touched. And this is an amazing extension. That's why I love working with Hybridge clients. I really love the type of work you all are doing. I think the confidence around the process, around the lab, around the techniques, around the training that you all have built. I've gotten lucky enough to spend time with Hybridge doctors. And first of all, you are a great group of doctors, a lot of fun, a lot of great people, but the process gives so many people the confidence. If a doctor is listening who says, I've always wanted to, be involved in something like this, or maybe I didn't lack the confidence, or maybe it's not me, maybe it's a doctor on my team that wants to get involved in something like this, even if the owning doctor doesn't want to. Who's the perfect doctor? Who's the ideal fit for a Hybridge doctor? Besides being a fun, good, great person, by the way, because you guys have some great people.
Well, all right. So nice, open-minded. The thing about, who's the ideal doctor? I would say mindset is important. But there are some basic things that you have to already have in your toolbox. Our best Hybridge doctors are doctors that have dedicated their careers to continuing education. They've taken a lot of the continuums out there, whether it be a Spears course or a Pico's course or a sedation course, or you name it. There are different courses out there with really leaders in their field where if you want, whether you're a specialist or whether you're a general dentist, where if you say, you know what, I really want to become an expert at that, you can go out there and do that. That super GP thing, that's a real thing. There are some real talented clinicians out there that have the mindset to just keep going. And they're never satisfied with their knowledge base. And they're in the gentleman we have a mutual friend, Eric and I, Jeff Mader in South Bend, Indiana. But, gentlemen like Jeff, if you just used mindset as the differentiator, these are people that always want to learn. They don't quit when it gets tough. They have an obstacle, they hit an obstacle, they lick the wounds, they get up and they go, you know what, I'm not going to do that again. And they get past the bumps in the road to get to that flow of, all right, I'm getting it, I'm getting better. The confidence does not come at the beginning. The confidence comes at the end. You've got to really have a lot of courage to get there. And I think so. When I say good mindset, that's really what I'm talking about. But if you're going to do full arch surgery, you have to be surgically talented. You can't go in there and do a full arch surgery and not have had reps, like be comfortable in, full flaps and extract full extractions and bone reduction and really understanding how to control the surgical field. These are things that a lot of doctors do before they get into full arch. They're doing impacted third molars and they're doing complex procedures. They just haven't put it together with the next thing, which is the process of Hybridge. Those are the doctors that really, I think, are ready to go. Where we see people get hung up is where they haven't already done that. They haven't felt comfortable surgically yet. And therefore, when they get in here, they go, wow, I'm not sure I'm ready for all that. You give them a process, that's great, but they need to get used to it. And there are some programs out there, and there are a lot of patients out there, by the way, that need dental work that would be perfect patients to, with a mentor, work with and develop these skills. Prosthetically also, all of us dentists take prosthetic, courses, denture courses in dental school, but a lot of them haven't taken a course since they were in dental school. So, at its core, full arch is about putting teeth in space and correctly deciding where they go. Our protocol is very much about teaching you how to do that well. And so we can teach you the prosthetic side of it very well, and give you the parameters. That's part of our process. We quantify tooth position and we never lose our way. So when people say, what's the biggest difference between Hybridge and other things, we are an indexing technique where we will show you how to put the teeth in the right position every time. So I hope does that answer your question?
It answers it. It actually answered it perfectly, because, by the way, there are so many people listening right now. They're like that are thinking through that, and that was really helpful for a lot of people listening, because they want to know. When we see Hybridge, speaking now from the business side, Hybridge really truly does grow the ability for a practice to produce at a higher level, whether that just be average revenue or overall revenue. And so practices that are really embracing the Hybridge method, I've firsthand seen over and over again what Hybridge does from a production standpoint inside of a practice, and its ability to impact and its ability to do amazing things, getting everyone involved. So one of the things that the Dental Wealth Podcast has, we have a lot of people that listen that are also 4 locations, 5 locations, maybe they have 10 doctors. And so if a group's listening to this, I know there's a lot of individuals listening, but also for someone who maybe has a larger clinic and maybe has 5 or 6 locations, and they say, we've really always wanted to bring in some type of a full arch system into the type of work we do. Because what happens is oftentimes is they will bring in some type of surgeon, but they'll have that person work 2 days a week as a surgeon. Outside of that, they don't really embrace these, this type of work, because I think it's a confidence thing in many ways, not just with the actual lab, but also with the process and those types of things. So if you're that person, does Hybridge fit into, a larger scale practice, or is it really more designed around that sole practitioner? Or what about the group practice who says, we have some doctors who'd really love to get involved in this or bring this into our curriculum?
Well, I think the multiple practice in a geographic area, I just had a conversation last week with a doctor in Dallas who has 14 offices in an area of, I think, about an hour and a half radius. And they don't offer full arch in any of the 14 locations.
And we see that.
But they have thousands and thousands of family visit appointments, like literally the volume of families going in and out of these locations every year is just a huge opportunity. If you had a new offering, a full arch offering, just with what's inside the 14 sets of walls and yeah, I think what you're saying, Eric, is how do you execute on developing a Hybridge team within that network, whether it be a couple, 2, 3 offices or 14 offices, is an unbelievable new business model that starts with just finding the right doctors with the right training, with the right capabilities. And that's like just add water and poof, you've got yourself a real business in a business.
I love this stuff because I'm like, it's just, I could talk to you about this for hours and hours. I really,
we got like 3 hours on this podcast.
3 hours, right? This is a 3 hour. Guys, stay tuned. We're and this
right.
is no.
We have a commercial break come through.
Well, I really look. I have a tremendous amount of respect for you, Frank. I've luckily got to know you on multiple levels, and I'm really weird. Most people know about this podcast. I only invite people on that I really respect, and I really do think is doing great work. I don't just bring on a guest every week just to bring on a guest, but people I highly respect, and I really respect the work you do.
It's mutual, by the way, Eric. I must say that when it comes to actually Eric and I, when we get together, it is just we do this for hours. It's been a real pleasure getting to know you guys. And Eric, you're what you add to the conversation for me is unbelievable. It's such a breath of fresh air.
Well, I appreciate that. Those doctors, because I already know there's a lot of doctors that would love to learn more about Hybridge and how it integrates with their practice. What is the best way for them to learn more about Hybridge, or how does that process start, or what would that look like for somebody?
Yeah, thanks, Eric. We have a national sales manager by the name of Jim Wheeler. We call him Wheels, but Jim Wheeler is the gentleman that you would want to get in touch with. And what he'll do is he'll walk you through, or he'll talk you through, what are we? Is there a fit? What are our educational opportunities that are out there? Most of our doctors come in for what we call our certification course. It's a 2-day certification course. They have been, over the last couple of years, they've been remote. Excuse me. But we're going back into the live mode with hands-on again, which is going to be fantastic. But those certification courses, we give multiple. There's multiple a month. There, you could talk to Wheels, and he'll get you hooked up with the right course in the right city. Maybe something's close to you. Once you do your certification course, you will understand the beauty of the Hybridge process, the protocol. Actually, by the way, I'm just going to throw this out there because I think clinicians, when they hear what Hybridge is, really, they're going to go like, well, I didn't know that's what it was. But clinically, imagine that you finish your Hybridge surgery, you introduce what we call an immediate provisional, which is a fixed provisional. It's a PMMA, it's an acrylic provisional. that has been designed pre-treatment based on some artificial intelligence of smile design and whatever. So now we introduce this fixed restoration, day of surgery, which in and of itself is sort of a bit of a miracle, because patients are like, you got to be kidding me. I can't believe I look so good walking out of here. They come back in 2 weeks. We hand them a mirror and we say, Mrs. Jones, if your final teeth looked exactly like these temporary teeth, would you be happy? And they typically 9 out of 10 times they go, I love my teeth. All we literally have to do is reproduce what we did day of surgery. But anyway, Hybridge Express Digital is a patent that we have, and we can literally put that patient into a CBCT machine. In 8 seconds, it captures the tooth position, the implant position, and the soft tissue level, which anybody who's listening will say, no, you can't do that. We literally do it in an 8-second scan. You send that scan to the Hybridge laboratory, and in 2 weeks, your final definitive restoration comes back to you ready to be inserted. It's hard to believe, because I've been doing this for 30 years, but the technology allows that to happen. And most people don't believe that that's what we do. So basically, the process is really slick. But I forget why I went off on that.
I love it.
That's right. Training.
Once we get a hold of Wheels, then we get a hold of Wheels.
How do we get a hold of Wheels? Is there an email?
Wheels. Yes, Wheels is Jay Wheeler at hybridgeimplants.com. Hybridge. Hybridgeimplants with an S.com. And maybe with the high technology you guys have, maybe we can put this in.
Yes, we will definitely put it
in over the top here.
But you have to go to the YouTube to see it on the screen. So we will put it in. Yeah. So we'll put those of you that are listening, go to YouTube. By the way, while you're there, hit subscribe. But we'll put all the information on the screen so you guys can capture that and learn more about Hybridge. You can see why I wanted Frank on this podcast. Those of you who are listening are already, I guarantee you people are already like, oh, I want to learn more. I want to learn more. So what I've seen Hybridge do for clinical offices is absolutely amazing. What I've seen it do for confidence, what I've seen it do for just so many things around this. And when I'm talking to a doctor who has not been introduced to Hybridge and they're trying to get their, really the super GP, they're trying to become the super GP. But what I find is they hit this point where they get stuck. And for me, if it's the right doctor, Hybridge is the way to get unstuck and to be introduced to a process that can really help them. And I know for 100% fact, because what I've seen it do, it's just a game changer. So for so many offices. So Frank, thank you so much for taking the time to be here. It's my honor. I'm just blessed to have you in the studio today. Thank you so much.
Well, gentlemen, this will be the highlight of my day for sure. Thank you very much. Matthew, it's great seeing you again. And
great to
Eric,
see you.
It's always fun.
It's always fun
to get together and chat. Yeah, thanks.
Well, I appreciate it.
Thanks for joining us. Make sure you guys always like, subscribe, check out Jim Wheeler, go to the Hybridge website, hybridgeimplants.com. So if you guys want to go and check out kind of what they do, see what their process looks like, where they're at, make sure you do that. Check us out on YouTube so you can get that link, as well as the email to Wheels. Hopefully, this is either great for Wheels or bad for Wheels. So,
and listen, this is that's right. He goes, where are all these emails coming from? Well, we have a lot of people that listen to this podcast. So just tell him, if he gets random emails, that's why. Also, remember, this is an episode. One of the greatest parts of the success of Dental Wealth has been from people sharing the podcast. We've heard more stories about how someone shared an episode that impacted somebody else. So what I would encourage you to do also, clinicians, take this episode and send it to a friend, send it to a clinician, send it to your peer group and discuss it together and lean in and maybe reach out to Wheels and have that conversation, because part of the power and the impact of this type of work, going through your ripple effect, by the way, Frank, because if they get Hybridge and they impact people's lives, we're part of now the ripple of Hybridge. So share the episode with people, because there's a lot of people in the dental world that need to hear this conversation. It might be the missing link for their careers and their practice. So I encourage you to share as well.
Thank you guys for joining. Tune in next week in the coming weeks for more great content, and we'll see you guys next time. Thank you guys.
Bye, guys.